Opposition NDP seniors critic Matt Love says for more than a decade, the provincial government has ignored experts and not made necessary improvements to long-term care in Saskatchewan.
All of the information that they need is right before them. Report after report from the auditor and the ombudsman, including folks who have come here to this building to share their stories with this government. We need them to listen to those voices and to adopt mandatory minimum standards of care.
Love and the NDP made a 2020 election promise to implement minimum hours of care per resident if elected. In 2013, the Saskatchewan Party government replaced those standards with program guidelines for care homes. Love says that did not prevent the COVID-19 outbreak at Regina's Extendicare Parkside, which saw 39 residents die.
Top of my concern is staffing. The folks who work in our long-term care facilities in this province are some of the heroes of the ongoing pandemic. They have served residents beyond what could ever be expected of them. But they can't do it at this pace forever.
Healthcare staffing was discussed by both Saskatchewan health ministers in Saskatoon at an event today. The minister responsible for seniors says the provincial government is working on hiring more continuing care aides. One change the government did make last year was to have the Saskatchewan Health Authority take over 5 Extendicare homes in the province.
Making sure that we ensure that the patients and the residents and their families were the number one priority as part of that transition, and that went very smoothly, is my understanding, and has resulted in now the SHA operating those facilities and taking care of those residents.
Hindley and Health Minister Paul Merriman say they have not had the chance to look over the voluntary standards of care. Merriman says the government is looking at expanding the role of nurse practitioners in care homes and registered nurses to try and get creative with staffing issues. Adam Hunter, CBC News, Regina.